Nicotine is one of the leading cause of death worldwide.
People often think that smoking is just a habit.
Most of the people who smoke are aware of all the negative impact what they are having, still they continue doing.
The addiction is so bad that it's not that easy that just a thought came, I want to quit, and they can. Is there something particular about nicotine that it makes it so difficult to quit?
We see in the movies, the heroes smoke in the different way. Certainly they're promoting in there.
If somebody is now trying to quit, can they just go ahead and do it?
Yes, it may work for handful of people, but not for majority of them.
There are alternatives like vaping. And they feel that vaping is not nicotine. They feel vaping is not smoking. It's completely acceptable. They replace smoking with vaping and they think they are on the verge of quitting. So is vaping equivalent to quitting, or is it even worse than having cigarette on it? Hi everyone, and welcome to another insightful conversation. With World No Tobacco Day around the corner, we are focusing on something incredibly important: tobacco cessation and how we can approach it in a smarter and a more sustainable way. This episode is sponsored by Tobacco Nil, a brand working towards raising awareness around nicotine replacement therapy and helping people take a step closer to quitting tobacco safely and effectively. And to help us understand this better, we have with us Dr. Pankaj Kumar, a senior consultant psychiatrist, psychotherapist, and a dedicated specialist with over 20 years of experience. He is the founder of the Healer Psychiatry Center and has an extensive background in clinical research, teaching, and mental health advocacy. He has also been associated with leading institutions like Sir Ganga Ram Hospital and Max Super Speciality Hospital and has significantly contributed to psychiatric research with multiple national and international publications. As we observe World No Tobacco Day, let's remember quitting is not just about willpower. It's about having the right support and the right approach. Thank you so much, Doctor, for joining us today.
Thank you very much for having me over for this important talk. Thank you very much.
So my first question that I want to start with is, why is quitting tobacco still such a critical health problem and it's a health priority today? And also, despite of increasing awareness, it's not like there is no awareness, but it is still one of the critical issues. So what can be the reason behind that?
It's a very important question you should ask me. I would put up this way: awareness, no doubt, it's increasing day by day with all the media, online stuff, a lot of things, YouTube and all those Facebook and Insta. A lot of awareness is going around. Yes, you're right, and a lot of ads coming, the TV and other mediums also. But in spite of awareness, it still persists and it's quite rampant. Why? Because addiction is so strong, it overpowers awareness itself. And addiction is not just, it's not just like a habit, we just have it. It's a part of, it's a specific word, addiction. That means habit you can stop by some discomfort, fine. But addiction, your mind craves for it, it's asks for it, it will ask again and again for it. That's why it's so strong, even in spite of having awareness. And just to put my point here, I would just rather say like this: a lot of people who, in fact, I would say most of the people who smoke or consume tobacco are aware of all the negative impact what they are having or they probably may have on their health, physical, mental health, both. Still they continue doing. They know they can have COPD, they know they can have heart disease, they know they can have infertility, they know they diabetes, if they have diabetes on the medical condition, it can get complex. They can, and including these, they can also have psychiatric illnesses like anxiety, depression, and what the medicines they are taking. For example, they are taking psychiatric medicine. This research shows that tobacco, if consumed or smokes, it reduces the impact of the medicines to around 30%. So it's all there in the open medium. Nothing is hidden. Then, in spite of knowing that, they keep doing it. So, in spite of having awareness, yes, still there, it's rampant and it's a problem area.
So basically they know everything, but still they can't help it but to be addicted. And even if they know and they try to be away from it, the addiction is so bad that it's not that easy that just a thought came, I want to quit, and they can. So the degree of addiction you're saying is actually on the higher side. That's why people are not able to stay off it.
Yes, this very nicely put by you. I would rather say spite of knowing it,
Yeah.
the addiction of degree is so high, they're not able to quit it. Because a lot of people say, I get my patients at my clinic and in my practice, they say, Doctor Saab, मुझे आदत नहीं है, जब चाहे छोड़ दूँ. This is very common line which I hear from my patients.
Right.
Day and day only hearing for this years. And when I tell them, okay, छोड़ के दिखाइए, and they are not able to quit it. And they come back to me, Doctor Saab, मैं नहीं छोड़ पा रहा हूँ. And that is the thing, there's awakening for them. It is not just a habit. It's an addiction thing. There's a specific pattern to it. There's a scientific base to it. That's why which people really don't know, and that is why this medium is very important to tell them exactly what's happening in the mind and brain. What we can see, addiction is just a type of a paradigm where it's a complex situation where it not just affects your thoughts, it affects mentally, psychologically, financially, a lot of the areas also. So yes, addiction do have an important role to play, and that is what we should tell them in right way.
Yeah, correctly you said, and that takes me to my next question where, people often think that smoking is just a habit and they're not addicted. But then how is nicotine actually an addiction from a medical perspective?
Yes, this is a very important addiction from medical perspective. There is a catch in the question. It's a very nicely put up question. So what we need to say, just I said just a few minutes back, habit is just which one can easily or with some difficulty, discomfort can leave. It's a habit. That's fine. That's different thing from addiction. What addiction? Addiction has systematic points to it. For example, addiction will have cravings. It will have tolerance. It will have dependence. It will have withdrawal symptoms. And patients, a person will keep consuming it, and despite knowing it, it is harmful for them. And there are the failed, repeated attempts to leave it or stop it, but they won't be able to do it. That's all about addiction as well. So addiction is so important. So there's a pattern to it. For example, when we coming to addiction part, it's not a habit. Putting up my scientifically and medically a term. So when consumes smoke or nicotine or tobacco, in any tobacco for that purpose, the smoke goes into the brain within seconds. There is a reward chemical dopamine pathway. That's called reward pathway of the brain that gets activated, and with that brain gets a kick due to that nicotine, and there is a cycle which goes on. The mind relates pleasure and reward to this nicotine intake, and that cycle goes on and on, and that's a pattern. And over the period of time, mind adapts to it, or brain adapts to it, the person adapts to it, and for them, nicotine or tobacco intake or smoking or becomes norm from them. Nothing addicted. This part of their life, and it's so complex to make them understand.
No, absolutely. And I have this word for the dopamine that you get when you use these intoxicants, which is called as dirty dopamine, because there is also something healthy dopamine that you can always approach.
Yes.
But then somebody who's watching this and who is still thinking that I'm not addicted, it's just a habit and I can leave it tomorrow also, मैं कल भी छोड़ सकता हूँ, उनके लिए आप can you tell 5 things which they can ask themselves which says that now they are medically addicted, it's just not a habit. So any 5 signs that our audience or viewers that they can identify and then maybe reach out for further help.
Yes, this is very vital, because a lot of people, as you rightly put, they are saying मैं कभी छोड़ सकता हूँ. It's a tagline for them, and they are falsely in belief to this. Either they want to believe that way, there is a lot of guilt attached to it, a lot of trauma attached to it, a lot of withdrawal attached to it. So they really don't want, at times they don't really, in fact, knowingly, they don't want to face the situation.
Yeah.
So for them, I would either say, simple test what they need to do. If you say छोड़ सकता हूँ आज, fine, we're happy if you can do that. We will really more than happy. Try quitting it for a day or even for a few hours, depending on the severity and if they're regular chain smokers. Please stop quitting it, and if you feel you can concentrate on your work, you can function properly, you can focus on your task without getting irritated, without getting frustrated, without being restless. Your sleep is fine, there's no mood swings, you're functioning as good as when you're taking tobacco, there's no change in your mood, physically, psychologically, behaviorally, and there is no rise in your BP. If you check your blood pressure, there is no ups and downs in the other parameters of your medical other profiles. So if everything is fine, so obviously you are not addicted. But on the other hand, if it is not, it's a wake-up call for you. If you feel restless, you're less concentration in the work, irritable, getting so sparked up at small things, and in the office, either at home, with your wife, with your kids, instantly you're getting irritated and you're not able to keep your cool and you're not able to focus your work, your exam, you can't study. If you have, if you have gone to go, if there's a pattern, some people attached to it for the daily patriotism. For example, some people require it for going to washroom. If you can't go to washroom without smoking,
Right.
that's a very common thing which you find out medical
Yes.
practice.
Yes.
Then you know this is addicted, and that's you just that line "मैं कभी छोड़ दूंगा" doesn't hold good here.
Yes, so I think somebody who is watching it and is still wondering whether it's just a habit or addiction, I think this is really going to help them. And now, I really want to know that is there something particular about nicotine that it makes it so difficult to quit to most of the people?
Yes, as you rightly said, nicotine is not just like any other chemical. It's not like just any other thing. I would rather say start my line with that. Nicotine is one of the leading cause of death worldwide, which can be prevented. There's a catch here,
right.
and that I'm not saying from my side. That data, you pick up any data, you will. It's a worldwide. So it is one of the prevent. Then also people keep doing it, taking it. So why nicotine? It's so dangerous. It is one of the dangerous most addictions what we see and face in our daily practice. Why? It is easily available, readily available, almost worldwide, different forms, different types, and it is accepted socially also.
Yeah.
There is no stigma attached to smoking. And in spite, if you see a lot of kids nowadays, adolescents, they start as a peer pressure,
Yeah.
just for style, just for some to just have a say in the group and just feel yeah, I'm in control, I'm the boss. So a lot of things are, and in our we see in the movies, the heroes smoke in the different way. So they're promoting different. Subtly they're promoting in there. So a lot of things are going around. So nicotine is a very strong thing, chemical, which is difficult to take out because. For example, what happens when we smoke? As I told you just now, there is a reward chemical dopamine that kicks in, and that becomes normal from the person. But if it doesn't get the nicotine, then person starts having withdrawal symptom, and he mistakes that withdrawal symptom to as getting restless, not able to concentrate due to some other reasons. They misplace their notions into that, and just to get relief out of that, they have they light one more cigarette. And then they get relief, and they think that this is the thing which I get relief from. My stress goes away. I'm able to concentrate. This is my jadi booty, my amrit, whatever they call it. But that poor fellow doesn't know it is nothing more than scientifically. When you had a cigarette in the past, your body got the brain got the dopamine. It was fine, and when the level gets down into the body and the brain was you starting withdrawal symptoms. In the form of anxiety, restlessness, and other forms, physical and mental forms.
Yes.
And then you thought it's something else. Then you took a cigarette and you felt better. So it was nothing. The withdrawal symptoms were answered by one more cigarette. And ironically, that withdrawal symptom was in the first place was converted by the first cigarette you took it. There's a cycle which goes on, and the person is sucked like a whirlpool inside with the cycle.
And now with these cycles, is there, because that is what we see with other drugs and also other addictions, where once you get into the cycle, every time to get the same effect, you have to increase the dosage. Is that true with nicotine also?
Yes, it's completely true. For any addiction, there are hallmarks, a few symptoms which we follow medically. There should be craving, there should be tolerance, there should be withdrawal, they should be used in spite of knowing that it's going to harm them, and there is failed repeated attempts of leaving it but not able to leave it. So craving means when one doesn't take that substance, you feel to take it. Till you get it substance, you are uneasy, restless, and the forms of problem what I just told you. Secondly, tolerance. What does tolerance actually mean? For example, when you used to get a kick out of a cigarette, it work well for like one cigarette 2 days for whole day.
Right.
But gradually require more cigarettes. Then the frequency get decreased. Like one you can for 4 hours, 3 hours, then gradually 1 hour. And at times we see chain smokers who don't let the cigarette get away from their mouth. They literally light one cigarette from their cigarette and they keep on smoking. So gradually tolerance is developing. The amount of kick the brain was getting from that amount of nicotine, it is reduced. You don't get that amount of kick anymore. So you need to have more cigarettes for that. That's tolerance is number 2. Number 3, withdrawal. When you don't get the addiction substance, whatever, nicotine or tobacco in this case, and other, for example, drugs, whatever it can be, then you have withdrawal symptoms. The body tells you to have it. The brains give you signals to have it because it doesn't function properly normally. Then thirdly, taking it despite knowingly it is harmful. People know it's harmful for their health. It will cause you cancer, it will cause lung cancer, it will cause you heart disease, it will cause you stroke, it will make complex for your medical problems if you have any. So they know it, then they also keep taking it. And fourthly and lastly, some of them, a lot of, in fact, not some, a lot of them try to kick it out the habit because somehow they know it, but they're not able to do it. There's a repeated failed attempt. So it has all the hallmark symptoms of a substance which leads to addiction. So it is as harmful, as dangerous as any other addiction in the market. Any drugs, smack, opioid, any other thing, alcohol. So it is into that category. Yes, it do tick all the boxes, and it is an addiction thing.
Okay. And like people, when they see, different videos on social media, and they just sometimes, of course, there's a fear generated when you know what it can do to your body in long run. They decide that I'm just going to quit. So, is just quitting cold turkey always effective for somebody who has been consuming or smoking for a while, or it can be challenging for most of the people? So, if somebody is now trying to quit, can they just go ahead and do it?
We need to understand here, cold turkey, yes, it may work for handful of people. Yes, it do work for some, but not for majority of them. Because smoking is a complex addiction what we're dealing here. It's not just having something. It works simultaneously on different levels. First of all, it works on biological addictions. For example, the mind is wired in certain way. It needs that neurochemical to function in proper way. So that is biological craving. Secondly, we come of psychological aspect to it. Psychological aspect, but people generally attach smoking to certain. For example, they attach to go to washroom. They attach to socializing. They want to relax. They have a cigarette. They want to go out with a girlfriend on a date or with friends. They want to have a cigarette there. If they want to the whole after working full day and they are very drenched and they want to relax, they light up cigarette and they set up and they enjoy it. They enjoy it in the morning with a cup of tea or with a cup of coffee. So that psychological thing is there attached to it.
There are a lot of associations.
Yes, you're right. There are a lot of associations to it. Yeah. Number three, comes neurobiological aspect is there's a cue conditioning to it. For example, somebody having a coffee, so automatically mind will tell to have a cigarette. So the mind has attached coffee to a cigarette. Whenever the person he will have to have a cigarette. Mind will tell have a cigarette. So it is such a complex thing. It works at different levels. So it is just can't so easily left on a cold turkey basis. So that's why we need a scientifically assisted manner or therapy or help for the person so that they can quit it in a comfortable way and a better possibilities or better results. So it's not relapse again and again.
So this entire de-addiction process has to be like a hand-holded process where they feel they have somebody properly guiding them, certain things to fall back on. So it can't just be, doing it abruptly. If there is a proper way by getting an expert or getting help, I think that becomes a very foolproof way for de-addiction for people who are trying to do that.
Yes.
Right. And now this next question is something I think we see a lot with the younger generation, where there are alternatives like vaping, and they feel that vaping is not nicotine. They feel vaping is not smoking. It's completely acceptable, and they replace smoking with vaping, and they think they are on the verge of quitting. So is vaping equivalent to quitting, or is it even worse than having cigarette or nicotine?
This is a very good question. Thank you for having this question in your talk show, because nowadays a lot of adolescents and younger generation,
even school kids, in fact, I'm observing. That's scary.
That's the sad part. I'm going to that part. It's good you brought it up.
Yeah.
School kids. I get kids from school, so it's commonly accepted socially and more of a style statement, or there's a misconception it is a very safer option other than smoking. But few countries have some programs. They use vaping. Initially, they started using vaping as a harm reduction thing. It was promoted, don't have tobacco smoking because it has a lot of harmful effects to it. All have vaping, it just have this thing. But ultimately, with over a period of time and research we have followed, people are getting addicted to vaping as well.
Right.
And this is increasing day in, day out so strongly. So there is a dual addiction as well. People vape as well, they smoke also. This is getting trend. And when the vape does vaping, they don't know, they are feeling it's not harmful. They have got a false perception. It's fine, it's safe, because it's promoted that way. That's a norm in the generations. So they keep doing it. At the end, it increases so much. It's really hard to manage. And hard part, it's come in different flavors. Kids come to my clinic. they डॉक्टर साहब इसको खाई नहीं है, तो ये तो सिर्फ फ्लेवर है, nothing, smoking तो मैं कर ही नहीं रहा, it's not tobacco what I use it. So it's really difficult for a job to tell a kid of so studying in 9th, 8th class, 9th class, or to make them understand the harmful effects of tobacco and nicotine and vaping. So it's opening a doorway for them bigger addictions to come. I've seen in my practice kids start with vaping, then they put up smoking as well, and nowadays to also all the different path. But I will try to put up here. A lot of days kids are going into weed and cannabis use as well. For them, it's a normal new smoking. New smoking for them is cannabis. Smoking is off the track. Right. So they have normalized smoking with the Western culture. A lot of countries legalizing cannabis. So for them, smoking is so. And research we have find cannabis is said to be the gateway of addictions. It opens doors for bigger addictions, cocaine, heroin, smack, and whatnot. So just so seemingly harmless vaping, you can see what it leads to. So it is not it's completely safe. And I've seen kids who haven't touched a cigarette in their whole life, but they vape so much, and the amount of nicotine they're consuming it way higher, and it's so dangerous for their health.
Absolutely. So, I just want to make this one thing very clear for somebody who's watching this, that just because you're vaping does not mean you're not having nicotine. Do vapes also have a certain percentage of nicotine in it?
Yes, it do have.
So vaping is not like something you're doing without nicotine. Yes. It still has traces of nicotine.
Yes.
Yes. Okay. And now I want to move to, a different segment where, we talk about de-addiction also. So someone, who is hearing about nicotine replacement therapy for the first time, can you explain about that a little more? And can you also explain how does this actually help in the process of de-addiction?
Very vital part of any de-addiction, because when one consumes tobacco in any form, for example smoking or chewing or any form, so as we discussed earlier, it leads to addiction. That's now what we have discussed.
Right.
So when addiction is there, when one doesn't take tobacco in any form, the brain will have withdrawal symptoms, which we already discussed. So person won't able to function properly, and they won't be comfortable, and they will feel uneasy, restless, whatever discussed just now. So what is NRT? Basically, it's a type of a nicotine which is safe, scientifically approved, and it doesn't have any toxins like the tobacco. For example, when people cigarettes smoke, they all talk about we are taking nicotine. A lot of people rarely know with nicotine they are taking tar. They are taking a lot of thousands of harmful chemicals and carcinogens, which can lead to cancer and a lot of harmful side effects and health problems. So they are not aware of, and they don't know. But with this NRT, they are taking scientifically approved, sustained way of tobacco, and which is very in a safer limits and in a medically what we call supervised way. So it is a safe way of quitting your smoking and coming out of the addiction cycle.
Okay. And now with NRT, what are the different forms that are available, and how should one choose the right form for themselves?
NRT, there are different forms. For example, like from patches are available.
Yeah, so the nicotine patches.
Nicotine patches, yes, you rightly said. Which is like a band-aid. When you get hurt, you put a band-aid on your finger or whatever place you hurt. Similarly, there are patches which you put on the body and they work and for you. Secondly, you have lozenges, pastules. You have got nicotine gums. Okay. And in some countries, they have got nicotine sprays also. Although as of nasal sprays, which probably I don't think we have in India as of now, but they're in some countries. These type of different nicotines, NRT, what we have here.
Right. And now somebody who is, getting on these products like the patches and the gums, because those are also very easily available and accessible. For them, I want to also address how safe are they, how effective they are compared to, completely quitting without support.
Yes. First of all, nicotine replacement therapy, NRT, is a scientifically researched technology or type way of medical treatment which is followed worldwide, globally, basically. Right. And it's been there for quite some time. Now it's not nothing new, so we are afraid of. Yes. So it's there. Its research has been done. We have robust data to support it, and we have a lot of cases people who tend to quit smoking without NRT help. The researchers tell the relapse rate is very much higher if they try to do it by themselves without NRT.
Right.
With NRT, the relapse rate is quite low and success rate is quite high. That's one thing. Secondly, as I told you, in NRT, you are not giving them any harmful toxins or carcinogens or tar, which we did get in tobacco. So they are getting a safer, medically proven thing. And thirdly, it is they, for example, patches. You have a certain mg for that, something that comes on certain mgs for similar gums. So as that's decided by the medical doctor or psychiatrist or medication specialist, depending on your addiction, how the severity is, how the frequency is, how much cigarettes do you consume, or tobacco you must consume, and your medical complications. Do you have any? And with that, your lifestyle, your routine, and everything is studied in detail, and it's a tailor-made thing. It's not doesn't like one size doesn't fit all. It goes here as well. It's a tailor-made therapy. When the addiction specialist or psychiatrist or doctor will assist you in detail, they will have a profile made out of you, everything in detail. With some basic tests may be required to done to see your lipid levels and heart levels, LFD, KFTs, and simple CBCs. After that, so then they will make a tailor-made therapy for you, and then depending on the severity and thing, they will give you this NRT, what is required. And yes, patients' compliance is important here, and patients' comfort is also seen, what they are comfort with their patches or lunges. Generally, we tend to follow in our practice. For example, patches, which is very safe, very comfortable, doesn't have any side effect. They are medically approved. And what do you do? The patch, you put a patch, it will give a baseline nicotine levels to your brain. So the brain won't have those withdrawals, so it won't have the cravings, and we're giving a scientifically measured method. So what we do, like for smoking, you have a spike, dopamine spike. So and that stimulates the brain, so you want it more. So in this, there is no dopamine spike is there.
Right.
It gives you a sustained tobacco throughout the day. So there is no spikes. So you are in a control, and you are medically proven. You're taking medically proven thing, which is not harmful for you and your body as compared to smoking or tobacco consume. So that's why we have done in my clinic. What we see in a pattern, whenever there is stress, he has to do some coding, some demanding job. So he used to have stress. So that nicotine demand went up. So initially, what we did, we gave a baseline patch for the person. It sustained it well. And when the spikes were there, we gave him gums to attach to that. Whenever that spikes are there, the stress is there, you can have gum that to a measured quantity. That would take care of the problem, and we were able to take care of it problem, and he's doing quite well. Like that can be done.
So it has to be an entirely customized approach.
Yes, customized.
And it changes from individual to individual.
Yes, very rightly put.
Yes. Also, do you think that the awareness about nicotine replacement therapy is still lacking, especially in the younger generation, and also overall, in spite of platforms like Tobacco Nil trying to simplify the access as well as the education?
Yes, as just we said, it's one of the major leading cause worldwide of the preventable deaths. In spite of that, people keep taking it. Why? There are some reasons. The addiction is just one of the aspect what we discussed there. Another aspect is social, stigma attached to it, myth attached to it. A lot of people, lot of myths in the society. If you use a patch, use NIT, you will or gums, you will get addicted to it. It will you have to take for lifelong. If you go to a psychiatrist or a meditation specialist, then people will give you different names. Pagal doctor was ja rahe ho. And if you and moreoverly in the male thing I will tell, there's a false notion attached to it. Or which is like you are the macho man. You can't be weak from inside. You can cry. And sadly in our culture, taking help is taken as a sign of weakness. And that's a very big drawback, or this is a negative point which stops person from taking help from medical professional. So I would rather tell here and very strongly put my point here, quote unquote, taking help is not sign of weakness. It's a sign for maturity, it's a sign of insight, it's a sign you are aware of yourself, you want to help neither yourself. But it's a very important point which we put up here is when you smoke, you just don't harm yourself. You're harming your near and dear ones, you're harming your wife, you're harming your kids, your family, because you are doing the passive smoking. And research tells passive smoking is as harmful as active smoking. So it's not less harmful. So you are smoking, fine, it's your choice. But what 9-year kid, 10-year kid, small kids, a pregnant wife, your old age parents, what harm they have done? Why are you giving them smoke? Why are you giving them this slow death? They haven't asked for it. They are not enjoying it. You are giving them forcefully. So by taking help, you are not just doing good to yourself, you're also doing good to your near and dear ones. See how much harmful smoke and tobacco they were inhaling day in day out just because of you. So it's a whole paradigm which we are seeing here, and holistic approach is required to take care of all these aspects.
Right, absolutely. And now I want to move to some practical steps. So, if someone wants to quit today, what are the first 2 to 3 practical steps that they need to take?
For any solution, first step is to accept that there is a problem. Till we don't accept there is a problem, we won't go for a solution. We will live in a false world. Everything is fine. Sab badhiya hai. All is well. We will keep doing it, and ultimately all is not well. A lot of things are unwell, and you're getting unwell day by day.
Yeah.
So first thing is acceptance should be there. Be strong enough, aware enough to accept. Yes, I have an addiction problem.
Right.
I have the criteria which we just told in the past. See to that. Be aware. When you accept once your problem, then automatically you will have go for solutions,
Right.
which we discussed just now in RT. And this one thing, medical treatment. Other than that, what you can do as a person, you can tell yourself all the harmful effects you are having and medical data along with you, so to kick back to your quitting smoking and stuff. So start doing it. Go for it. What is the criteria which I tell my patients? Psychologically fix a date, concrete date. This date I am going to stop my smoking. For example, whatever date, maybe 1 week from now, 2 weeks from now. So by this strategy, the mind is conditioned to a way कि इस दिन के बाद मुझे सिगरेट नहीं पीनी है. 15 June, whatever date may be, I am not going to get a cigarette. So I have to quit it. So mind gradually is conditioned to that thing, number one. Number two, what you can do, have a support system ready with you. As we just discussed, I was supposed to tell your family members, bring them on board, have your friends near them whom you can confide into, bring them on board. And if you feel if required, we have a medical professional help, bring that on board. So have a strategy plan to it. Go for it. Thirdly, write down your stressors. It's very commonly seen. Everyone probably may have the stressors. And see, stressors tend to increase the smoking intake, tobacco intake, and tend to increase the relapse rate. So know your stresses. Everyone there may have their own stresses. Some emotional stressors, some financial stressors, some work stressors at a job. Some are not sleeping well, they're not eating well, the lifestyle is a problem, is really messed up. So really know your stressors and work on them. That's very importantly. Fourthly, there is a 4D strategy which I tell my patients. When you have the craving of the smoking, first is to delay. Don't just go for the packet. Just delay it, whatever. Abhi nahi lunga, I will take little 5-10 minutes, 10 minutes, half an hour. Delay. Keep delaying the time you can do it.
Right.
Don't keep the cigarettes readily available in your pocket. Keep it somewhere far away, so you don't put up a hand and you have a cigarette in your hand.
Right.
So delay. That's one thing. Second is to deep breathing. When you have the craving, start deep breathing. This relaxes your mind, gives some more oxygen, and just calms you down. That's important. The delay, then deep breathing, then is drinking water. It's hydration, scientifically proven. It instantly reduces the craving, and because hydration is a very good tool to that.
Right.
These 3 things: delay, drinking water, deep breathing, and then fourth comes very important: distract yourself to some important work, some talk to your family friends, some wife, some do your official work, go for a meeting. When your mind gets distracted, automatically the craving spikes and this goes away. And we should know that research has told us the craving is not forever. Withdrawal is not forever. The withdrawal symptoms peaks to a limit within minutes, and then goes down. So this whole cycle ends within minutes. If we can control those spikes, we can really do a lot of wonders to our health, and we can really control that.
Right. I think these 4 Ds are really going to help somebody watching this today. And next, I want to ask something about that I personally love to work on, and that is, what role does lifestyle factors like stress, sleep, nutrition, physical activity play in managing the cravings and also supporting this journey of de-addiction?
It's a very vital question what you asked me. I'm happy you put up in this questionnaire of yours. And sadly, it is the least talked about.
Yeah.
And people really tend to not give much attention to it.
Right,
And
right.
I would rather say this is should be the foremost thing and the first thing for any de-addiction therapy,
Right.
including this tobacco de-addiction.
Yes.
If you don't have a good lifestyle, good nutrition, good habits, so automatically you're not going to fail. the failure rates will be higher, lapse rate will be higher, and your progress will be slow and really not that good as it could have been. So yes, it just has got a very good important role. Example, if you get a good nutrition to the body and brain, so it automatically get all the vitamins which are required when there's withdrawal symptom, our body needs more of vitamins, more of energy, more of calories to fight it out, to have good immunity. So automatically this nutrition, good height will help in that way. Hydration, as I told you, it calms your system, it takes care of your craving impulses and spikes, it will happen that way. Sleep, again, is a very good important thing. If we sleep, nowadays we see kids doing attached to their mobiles, their video games, even everyone. So online addiction is increasing. The sleep pattern is going haywire. The sleep pattern is going haywire. That again, when we see in the research, sleep is not good, not sound, not comfortable sleep. That it increases the withdrawal symptoms. It increases the relapse rate. So good sleep for good mind and body is much most required, and ultimately should have a network, strong connected network in the real world, not in the real world, not the digital platform. In digital media, we see they may have a lot of thousands of friends, but in the real world, they really hardly have friends to convert into, because during this therapy, this treatment of stopping of smoking, you will have low patches. You will have patches where you will emotionally shattered. You will want some shoulder to put your head onto and cry onto it. And you need family and friends at that moment. So ultimately, you should not stumble back. You have some solid to put up in a back and support you there. That's very important. Well, and most importantly, have a physical activity routine. Gymming, yoga, exercise, whatever suits you, whatever you want to have it. Because it's not just for your physical health, it is also for mental health. Right. Exercising naturally releases endorphins and it stabilizes the dopamine craving and it spikes in this. Yes. So that naturally it heals you down and gives you positive, happy hormones, which automatically takes you away from the smoking and addiction thing. So yes, this stress elevating factors, this habits of good food, sleep, and exercise go a long way.
No, absolutely. I think everything that somebody wants to know about, nicotine addiction, dependency, and also how to get out of it is something that you've addressed so beautifully. But, towards the last segment, I want to ask you any one message that you can give to someone who is still very hesitant about quitting, but wants to quit, but it's not happening.
I must compliment you on the choice of your questions. You are hitting on the bullseye. These are the questions we require to be answered. People keep on talking this and that, but they don't come to the point. They don't talk about the hard facts. They don't talk about this real facts, what you're dealing here. I'm really thankful to having on this platform. So it's very important for the awareness what we're doing here. Thank you to you first of all. And coming back to your question, I would rather put off my answer like this. Don't wait for any major illness or major heart attack, major problem to be your motivation to quit the smoking. Don't wait for that day. You probably may don't have the time. Your family won't have the time to retake you to the hospital and timely and save you and your life. So automatically, it's not about you. It's about near and dear ones, the family, what you're dealing here. So don't wait for that day. Start now. Today is the day. Jab jago tabhi se. That's say goes on. So there won't be a special day to quit smoking. You start doing it. Start thinking over it. And when you will think over it, then only you will do it. If you won't think it, you won't do it. So think actively and sincerely on doing it and stop the habit. And I would say, yes, addiction is powerful. But when you have willpower and you really want to stop smoking, that zeal is even more powerful. And then the reason to stop quitting. Yes, you can do it anytime with the help, medically proven help, with the help of NRT, with the different means what you have. Don't hesitate, don't stigma and other factors. Get into a recovery cycle and path. Do it, you can do it, you have the power. And I will repeat, taking help is not a sign of weakness. It's a sign of strength. So please go and do it for yourself and your family.
And I think prevention is better than cure, because later on you have no time left.
Yes, bang on.
Yes,
That's a gist.
But thank you so much for joining us for this wonderful and meaningful conversation. And I'm sure it's going to help everybody who's going to watch this, not just for themselves, but if their friend, family, anybody struggling with an addiction or with any dependency, I'm sure it's going to add value to them. Thank you so much.
Thank you very much for having me. I just loved it, and it was very important what you discussed there, and I'm surely it will going to have a lot of people around who will watch your podcast. Thank you very much.
Thank you so much.
And thank you, Tobacco Nil, for supporting this conversation and helping spread awareness around safer cessation options.